Hi, I'm Ken Howard, and welcome to the Gay Therapy LA podcast. Today, I want to talk about gay men and kink sexual health, notes from the 2022 CLAW conference. So, licensed psychotherapists like me are required by their state licensing boards to take additional education each year, a certain number of course hours, in order to renew their licenses to practice. And it keeps us fresh to be helping our clients with up-to-date research and clinical best practices of the field. Other educational opportunities might be useful for our practices, but don't necessarily count toward formal continuing education. So the recent CLAW conference, the Cleveland Leather Awareness Week conference held in Los Angeles over the Thanksgiving weekend, offered some of both. And Cleveland Leather Awareness is an organization from Cleveland, Ohio, that is affirmative of the LGBT and kink communities, with kind of a heavy emphasis on gay men and particularly the leather community. But it's more diverse than that. So, as a nationally certified sex therapist in the United States through AASECT, the American Association of Sex Educators, Counselors, and Therapists, I was eager to attend many of the seminars that they offered concurrently, but like with most conferences, it's impossible to attend everything that's offered. But I wanted to share with you some of my observations from some of the seminars that I attended during the weekend, which, in addition to being educational, were also great for peer interaction and affirmation and validation of the broader kink community, especially for gay men in the leather and rubber communities. So, in earlier articles and in earlier podcast episodes, I discussed Doug Braun-Harvey and Michael Vigorito's 6 principles of sexual health that they describe in their book, Treating Out of Control Sexual Behavior, which is kind of a challenge to the very problematic sex addiction model. So I applied those 6 principles of sexual health more specifically to gay men in a previous episode, and you can check that out if you want, the 6 principles of sexual health as applied to gay men. And I've also discussed ways that gay men can explore kink play in some other episodes. If you look at the episode list and just look for the word kink, you can kind of index them and explore those if you'd like. Those are somewhat similar to today, but today I'm offering some different discussions. So some of the seminars offered at the CLAW conference offered tips kind of in more detail of kink play. And there's 7 areas I'd like to discuss today, in no particular order. So number 1 was a seminar more in the academic and clinical realm that was a little bit more formal, and it was entitled From Rape to Rapture, Understanding Kink Play as a Therapeutic Approach to Past Sexual Trauma. And this is by Andrew Parry, P-A-R-I, and he's a LCSW, licensed clinical social worker like me in California. And this was part of a broader organization called the Community Academic Consortium for Research on Alternative Sexuality, CARAS Research, C-A-R-A-S research.org. And, that's an academic body supporting just what it says, research on alternative sexualities. And kind of under this sponsorship and support from CARAS, Andrew Parry made this presentation. And what he was talking about under that title, From Rape to Rapture, Understanding Kink Play as a Therapeutic Approach to Past Sexual Trauma, was talking about his work as a clinician, as a therapist in private practice in San Diego, California, on the somatic mastery of sexual trauma model. Now, somatic, of course, means of the body, and mastery means, gaining skill or control of something. So the somatic mastery of sexual trauma model from Andrew Parry was attended more by mental health professionals and I think some physicians. But it's his model, what we call a technique, let's say, of using psychotherapy can be called a model of psychotherapy. And he works with treating adult women sexual assault survivors. And so the somatic mastery of sexual trauma model is a technique kind of like other psychotherapeutic techniques you might have heard of, like cognitive behavioral therapy, dialectical behavioral therapy, psychodynamic therapy, acceptance and commitment therapy. These would all be examples of evidence-based psychotherapy practice, which means these are therapeutic techniques that have been shown, evidenced, if you will, to have clinically effective outcomes from formal research. It's not just guessing at whether or not these techniques work. They've really been measured, and so they've been legitimized as psychotherapeutic models that, at least for the research groups, were proven to have symptom reduction or some kind of effective outcome for those clients or patients. I use both those words. So Andrew Parry mentioned a quote from Levy in 1998 on one of his slides that said, "A traumatized individual reenacts a trauma in order to remember, assimilate, integrate, and heal from the traumatic experience." And he found, perhaps surprisingly, that guided consensual non-consent reenactment of rape and sexual abuse experiences may reduce survivors' trauma symptoms. And this is something he's presented at in other conferences and other community education. And it's about the sexual assault or rape survivor gaining mastery over what happened to them, not a re-traumatization. And he talked about some important differences. And it includes elements of other types of therapy techniques where somebody might recover from PTSD, post-traumatic stress disorder. Elements of prolonged exposure therapy, which sometimes combat veterans have used to overcome trauma after combat in war. Drama therapy, somatic experiencing, and trauma-focused cognitive behavioral therapy. And these are all, therapeutic techniques. So the somatic mastery of sexual trauma model includes a lot of preparation, identifying the client's traumatic memories, and then designing a role play with a very trusted role play partner who portrays their perpetrator. And then there's a discussion of what the aftercare might look like. In kink play that gets very intense, there's an important component of aftercare where you kind of break character and relax and talk about your experience. So, and how you take care of yourself and your partner after some type of kink play, particularly where BDSM dominance and submission dynamics are involved. And in this case, the role play. So they prepare for that. Then there's the enactment of the event in role play. Then there's a therapeutic processing of that experience and a review of the trauma points. So the benefits or the outcomes of this model, as controversial as it kind of sounds at first, to reenact a rape, I mean, what the hell is that? But that's kind of the first glance. On a deeper examination of this model, it actually has therapeutic benefits. And so the benefits or outcomes that Andrew Parry has consistently shown in practice include overcoming the fear of the event by reliving it and restoring equilibrium to the heightened arousal response of the brain. Lots of stuff happens to the brain during a traumatic experience. It's recording in memory, it's recording the senses. Of course, there's an intense fear and arousal response, and that's what causes trauma. But this technique replaces a generalized fearfulness that the post-traumatic stress disorder patient might have after the event with the specifics of that person, of that perpetrator who hurt them at that time. So through the support of a trusted person, your role play partner, you're experiencing the ability to care for yourself in a way that the survivor couldn't do at the time of the traumatic event. And that can reduce symptoms of anxiety, depression, avoidance of things, intrusive thoughts, dissociation, and desires to self-harm. In other words, it reduces the symptoms of PTSD. It also increases self-confidence, sexual pleasure, interpersonal connection, focus, and it reclaims. Reclaiming is my favorite word in trauma recovery that I work with my own clients on. Reclaiming your life after a traumatic experience has happened to you. And it reclaims the self from the damaged, worthless, broken feeling to a sense of wholeness and wellness and self-mastery of your life. The trauma is recontextualized as a bad memory versus a present intrusion. So Andrew Perry's practice is called Sexual Assault Awareness Incorporated, and his website is saawareness.com, so you might want to check that out. I'm a big believer in giving credit where credit is due. It's exciting to talk about this model, but let's give credit to dear Andrew Perry for presenting this at the conference. And this is kind of just the tip of the iceberg, I think, but he makes a really good point about how cutting edge therapeutic techniques that involve kink role play can be therapeutically healing. So he's made an amazing contribution to the clinical and academic and social understanding of how sexualized role play can have this psychotherapeutic and clinical application. So other parts of the conference were about learning and expanding and refining sexual kink play among consenting adults. So the second seminar I want to tell you about was called Kink and Queer Health with Dr. Carlton. I love the Instagram Reels tips from Dr. Carlton, and he's a gay gastroenterology physician based in San Diego also. He's Dr. Carlton, just DoctorCarlton, Dr. Carlton on Instagram, and a website, drcarlton.threadless.com, meaning no threads, threadless.com. And he was so instrumental in educating gay men about the recent monkeypox epidemic and offered some great insights in a question and answer session with Claus, one of the hosts named Beau Jest. And the first banter between the two of them, between Dr. Carlton and Beau Jest, included tips such as trying different positions in topping bottoming, the importance of using generous amounts of lube in anal sex. He suggested a preference for the silicone-based lubes in order to prevent friction or tears in the anal canal, and the importance of having sexual health screenings of what he calls swab where you play, meaning having a cotton swab in a clinic or doctor's office in your mouth or your throat or your anus, and have that swab for the presence of any pathogens that are sexually transmitted infections. He's also a big advocate of something called the butt clock technique, which is a top using a finger to gently press at the points of a clock of the anal opening of a bottom partner. And this helps to loosen up the sphincter and the anus and helps being penetrated be easier and also more pleasurable. So he was talking about just holding a finger about 2 inches in or so that correspond to the 12, the 3, the 6, and the 9 on the face of a clock, and holding that for 10 or 20 seconds or so. And this relaxes the sphincter muscle and makes penetration easier and more pleasurable. So he's big on the butt clock technique, and he goes into more detail on that on his Instagram. And I asked a question myself of Dr. Carlton that I had heard about elsewhere about the risks of choking play in sex, and he clarified that it can be possible to damage someone by their top pressing too much on their carotid artery in the mid-upper part of their neck. So he recommended that if you're a top or in the dominant role in choke play, to aim low on the neck, like where a necklace might be, and do more to this symbolically than a real hard pressing. Breath play can be intense in terms of dom-sub play, also just by the top covering his bottom's mouth with a gloved hand. That's kind of a kink thing, a black leather gloved hand in breath play. But, you remove it, of course, to allow your bottom to breathe, after a few moments of cupping. Any kind of kink play that involves the bodily systems, your circulation, your breathing, all that stuff can be risky, but the play aspect of doing things more gently and with common sense can really help mitigate those risks. He also mentioned the importance of being educated on PrEP, pre-exposure prophylaxis, the several medications that are taken either daily or in a certain intermittent model called 211. But it's usually daily, and this is not only for HIV prevention, but something he mentioned called doxyprep, which is the use of the medication doxycycline, an antibiotic that can prevent syphilis when you're anticipating some kind of high-risk setting, such as being involved in group sex play or going to a bathhouse or sex club. Being on doxyprep in addition to the HIV PrEP medications, he said might be a good precaution. So talking just to your own healthcare provider, a physician, a nurse practitioner, whatever, is very essential. And, if you go to a provider that doesn't feel comfortable talking about sex, especially gay sex, tell them to educate themselves, or you're going to find a new provider. It's important that you find a gay affirmative medical provider. That's not asking too much. It's your body, it's your health. You have a right to ask and even expect that, but not all providers are equipped to do that or willing to. That's the other thing. So the third kind of sample of the conference was a keynote address at a dinner. And at this dinner, it was held in a big ballroom, and most of it, nearly all of it, was gay men kind of dressed to the nines in really good leather gear, which is kind of a fun community building thing. Anyway, you have all these guys in variations on the leather uniform. It's just a lot of fun. And this was offered by another licensed therapist, a guy named Guy Baldwin. He's a licensed marriage and family therapist also in California, and he's been a friend and a colleague for a long time. He wrote the book, The Ties That Bind, among other books and works that educate people on BDSM play. And he's really one of the pioneers. He's an older guy, and he was really one of the pioneers of being an advocate, especially as a licensed therapist, being an advocate in kink play. So he's retired now, but he was kind enough to give this keynote address of this leather dinner one night at Claw. And, he stresses the importance of providers, whether it's psychotherapists or physicians or nurses or educators, being bold advocates for our LGBT and kink communities, because if we don't speak up, we lose the sense of community that our predecessors, like him and others before him, worked so hard to evolve in our society and in our cities. He discussed a list of tips for repairing a relationship, such as taking responsibility for hurting someone when you've hurt them, and when you make an apology, to pledge your best not to do it again, if that's what you truly feel. He says those are components of how you heal a relationship. He affirms the LGBT plus community by reminding us that parents, teachers, and society in general, growing up as gay men, they expect us to be in this box of social expectations, and when we aren't in that, there can be hell to pay for daring to violate the expectations of parents and society and teachers and blah, 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 blah. And he stresses the importance of defying this. Don't accept being put in the box by others if that's not where you want to be or where you can be as an LGBT person. It's about being who we are and allowing ourselves to be outside the box and support ourselves and each other in our right to be so and to do so, to express it. Gay is not just what you are, not just what you do, it's also what you are. But what you do can also be your choice. And that's part of the message of kink play, is saying that your body is your own to explore and express in all these different ways that please the senses. A broader definition of what sexual play can be. Number 4 was a session on beginning electro with Gordon Morris and master guy from Avatar LA, Avatar. Avatar LA is kind of a kink education group as well as a gay men's affirmative group, and they offer some good courses in Los Angeles. And it teaches community members how to have safe, sane, and consensual kink play. So in Beginning Electro, this introduction, it was a seminar about using both low voltage and high voltage play. So low voltage includes the use of a controller box called an E-stim unit for electrical stimulation, which when you use that with various plug-in style toys and attachments can provide exciting and sensual stimulation controlled by your top partner for the arousing stimulation of the bottom partner who has these things put on him or in him. So the attachments to an E-stim box can include a butt plug that gives a small electrical stimulation, penis base rings, penis shaft rings, flat sticky pads. If you've ever been to the hospital and had an EKG, those flat sticky pads with wires, very similar. And these all provide a gentle to strong, prickly stimulation of electricity that increases or decreases with the adjustment of the E-stim box. So a question from the audience asked if these toys might promote orgasm, and the instructor said while they can, they're often about pleasurable and fun stimulation on that pleasure and pain spectrum that doesn't necessarily focus on achieving orgasm, but is more the sensual sharing of the infliction and receiving of stimulation, which a lot of kink play is about the infliction and receiving of stimulation, right on that pain versus pleasure edge. And all of these different E-stim devices can be controlled in different configurations based on the capabilities of the controls of the E-stimulation box. There might be several devices that are attached to the box, and there's different programs that go from high to low or undulate, and just different ways that the box controls the devices. So that was low voltage stimulation. Higher voltage play can include using a device called a violet wand. And the violet wand is a thing that plugs in, kind of looks like a screwdriver, but then it's an electrical device plugged into a wall outlet, and a transformer inside the handle of the device modulates the current that goes into various plug-in glass tube attachments, kind of like a neon sign that emits light when electricity is passed through it in gas-filled tubing. So this instructor demonstrated how an attachment actually with a metal plane that he held on his body inside his belt can make his whole body a conduit of electricity. And so just touching your partner's skin can create this little spark of electrical stimulation that can induce various sensations on the surface of the skin or deeper in the body. The instructors were careful to point out that, electro-stim play is for below the waist only. Anything above the waist, you can't do like your nipples or something like that, because that runs a risk of disturbing a person's natural electrical impulses of their heartbeat, and that could be risky, kind of like a pacemaker does that. So it's important to get some specialized education in electro-stim play, not only for basic safety, but also for maximum pleasure to your bottom partner, and learning some of the versatility available and the options and uses. But if you Google E-stim systems or violet wand, you'll come up probably with listings of vendors who sell these kinds of equipment. They also mentioned, it's pricey stuff. The real junky stuff that might be available online for low prices might also be low quality and low durability. So it's a bit of an investment to have these kinds of toys and devices. Another one was called Flogging Fundamentals with Mr. Cyan. And Mr. Cyan is a well-known kink educator and respected figure in the community for her expert instruction and support of the kink community. And she demonstrated techniques for using a flogger, which is a handle with various fronds on it, which can be made from various kinds of leather or synthetic materials, like a nylon fringe. And so using the wall to demonstrate, She showed how to stand at about a 45-degree angle to your bottom and demonstrated a kind of figure 8 style of swing in the wrist to experiment with making an impact, a swing and a whack and a swing and a whack on your bottom's back or shoulders or butt. And also demonstrated how to avoid a wrap, where the wrap is where the fronds can overextend the back and hit the front of the shoulders or the neck of your bottom partner. And that can be kind of a non-fun, painful stimulation. She demonstrated how to maintain contact with your bottom subject, such as touching their back with their hand as you pause or end a sequence of swings. Like if you want to put down one flogger and pick up another, but just touching their back creates that connection and reassures them and makes them trust you and put their trust in your hands to stimulate them in this pain-pleasure way. So this was kind of a hands-on workshop, and the audience members got the chance to practice with various lengths and types of handle floggers, and also to practice with various lengths of leather whips, cracking the whip. And that's a little more, edgy, because of course whips, can be very dangerous. I mean, we've seen that in movies and through history. It's really a type of torture, beating slaves and all these awful things. But when this stimulation is done in an erotic way, and of course probably in a gentler way, it creates a stimulation. And this, of course, the big element there is consent. So, it's a cliche to associate kink play with whips and chains, but knowing the specifics of both safe and arousing, stimulating flogging play was fascinating. And these kinds of play induce pain of a sort, but it's more of a pain stimulation arousal that causes your brain to release its own endogenous opiate chemicals. It's similar to the thrill you get from riding a roller coaster, which can be stimulating and scary and pleasurable all at once. And it's always riding that paradox between pleasure and pain, but it's safer than actually ingesting a substance, like an opiate drug that manipulates brain chemistry. So this kink play has a lot in common with things like thrill rides at theme parks. There's always the importance of communication and checking in with your bottom. That was stressed in a lot of the seminars, and the importance of getting, some education and instruction to explore this kind of play. Because there is kind of maybe not right and wrong, but certainly effective and non-effective ways of exploring this kind of play. It's more sophisticated sexual interaction. Number 6 was called Sensual Rope Bondage with a guy named Shibari. And this was another hands-on seminar that demonstrated how to use sensual bondage using various kinds of rope, from nylon or synthetic to very soft cotton weaves or other types of, or hemp rope. And the instructor showed how to embrace your bottom, wrapping the rope around him with your hands, and this creates a sensual connection, not walking around him, like circling around him, but facing him and then wrapping the rope with your arms wrapped around him, behind your hands behind him. So he demonstrated how to use your finger like a hook, especially your index finger, to draw the rope through, like under his arm and through his stomach or chest, and to hold it straight with the other hand. And so you have this taut line, and then when you draw the rope through, you create this gentle vibrating sensation across the skin as the rope is moving across sensual areas like your bottom's nipples or the sensitive side of his neck. And most of these were done with the bottom standing up and putting his hands together in front of him or held behind him. But the instructor also demonstrated a rope routine with the bottom lying down on the ground and having one leg bent up and then bound that way through his leg and through his torso and arms. And each movement of the rope of the instructor, it was like a dance, the sensual pulling and draping of the rope, which is part of the experience, as well as kind of the thrill of being tightly bound by the rope and at the mercy of your dominant. So from there, others have used toys like gags or blindfolds, which manipulate your bottom senses. But tips like, draw the rope slowly to avoid a kind of rug burn on your bottom's neck. That was emphasized, as well as how to work with the remaining ends of a long rope, about 15 feet of rope early in the wrapping process, because there's this excess that you kind of have to keep out of the way as you're working close to your bottom subject. The next one was called Fisting Fundamentals with Donal and Damien. I think they're a couple. And this was a Q&A session about fisting, and it helped to dispel certain myths about fisting to those who didn't already know, like, no, you will not stretch out your anus so that you're permanently incontinent. That's kind of a very anti-gay, old wives' tale myth that's very negative. Fisting enthusiasts still function in the anal area the same as everyone else when it comes to, pooping and stuff. Because that's how the muscles work. They can be trained to expand and then also contract back to their normal state. So it can be very important to practice on penetrative anal toys such as a silicone cone. And guys were saying, sometimes they practice every couple of days with one of those toys to increasingly be able to take toys, or eventually your partner's fist, of increasing circumference more comfortably. And it's important not to rush that process of gently expanding and stretching your capacity to take the toy in case of the risk of an anorectal tear, which can be painful and dangerous and require, a doctor or a colorectal surgeon usually. So several participants in the audience mentioned the importance of certain resources in fisting, including the kind of lubricant used. Guys mentioned a product called K-Lube, and another mentioned J-Lube, with the audience consensus naming K-Lube as the better product and easier to use, according to their experience. They mentioned that this is a very slick powder and water formula that can be very viscous, to slide the hand in and create a heavily lubricated environment that's both sensual and safer to be well lubricated. But how do you clean up? So guys were giving tips. Dawn dishwashing detergent, that you might use in the kitchen. That sometimes helps to break it down when it's time to, wash your hands and wrists and clean up. Another guy said shaving cream applied to your hands will dissolve the heavy lubricant and take that off for cleanup. Another enthusiastic and very experienced fistee audience member was helpful to the presenters at various points. And his main advice to newbies, new to fisting, would be to overtrain. He says overtrain with anal toys like a gradually wider silicone butt plug, again, probably every couple of days, so that by the time you attempt to take your partner's fist for your first time bottoming as a fistee, especially if you're nervous, and people tend to be nervous for the first time for anything with a partner, that way you've overtrained your capacity for being penetrated, so that by the time your partner's hand goes in, you've learned to take toys that are even wider than that. So the actual hand circumference is smaller than what you've been trained for by using the toy. So if you overtrain, then your partner's hand will be more comfortable and safer. Now, this all can evoke a certain, why bother reaction, because it just sounds like a lot of work. There's lubricant, there's training and all that. But the presenters also emphasize that fisting is a pleasurable experience like no other. And while it doesn't exactly replace penile anal sex for these guys that were giving the presentation, they said that fisting is a different kind of sensory experience that also enhances a profound emotional bond of trust and connection between the partners, even if perhaps not exclusive partners. And these guys talked about, how once they became introduced to fisting and became really good at it, they're enthusiasts of this. They had these grins on their faces talking about fisting and being fisted as supercharged erotic experience. Let's talk about some perspectives now. So all through this conference, there was a sense that this was a specialized event that was mostly geared toward gay men, especially in the leather community. But it was also an important event in that even the host hotel, the Westin Bonaventure Hotel, an iconic landmark in downtown Los Angeles, was exposed, so to speak, to gay men walking around in either leather or rubber gear, or sometimes just a jockstrap, going in the hallways or to the elevators and back and forth to their rooms and stuff. So there were hotel ballrooms that were converted into sexual play parties, but even the hallway leading to this was covered by these thick black canvas sheets on metal racks to cloak any visuals, like doors being open, from being seen by the other guests of the hotel or the hotel staff. So it was edgy, and yet edgy when it comes to education, awareness, and cultural sensitivity and diversity is a very important thing when it comes to conferences. And this is how we grow as a leather community, sure, but it's also how we grow as a society, particularly with the more niche details of the broader global LGBT plus and kink community's experience. So kink play is not for everyone. It's not even for every gay man. And my training as a certified sex therapist taught me that straight people can be just as kinky, if not more, than the gay men. But exploring the senses and diversified ways of interacting with others can be an exciting element of life. And it's worth considering, even if it's ultimately not for you, because a lot of kink play is different when you experience it than it is when you think about it. That's one thing that I think is a constant in kink play, is that how something looks like it would feel and how it actually feels are two different things. It's actually better. Like when somebody was demonstrating the violet wand, he would hold it out and say, "Who wants to try?" So one guy, very reluctantly held out his forearm, and then, it kind of crackled and sparked, even at a low voltage. And then he said, "Do that again." So, he was trying it for the first time, and it was like, "Oh, okay, it's pleasurable. Let's do that again." And it became almost a competition about, who could play the most, because it really was kind of a fun sensation and, of course, very playful. So while conferences like this, do serve to validate the kink communities, I actually found it only semi-friendly. I like meeting new people, and there were actually few opportunities to do that, although, my own schedule that weekend, I was commuting from West Hollywood to downtown Los Angeles, about an hour's commute. And so I had to miss parts of the conference, especially some of the casual, social, or sexual events. And, lots of gay men in our big cities worldwide will complain that gay bars and clubs are filled with young, muscular, pretty boys who can be very stand-in model, and heaven help you if you're even slightly overweight, over a certain age, like maybe 40, oh boy, how old, or not traditionally considered someone with appearance privilege. And leather events can be like that too. My only criticism of that conference is that I thought it could be a little more camaraderie. And maybe I experienced that because I'm not young or built a certain way or have a face that belongs on a fashion model's runway. I'm a big advocate of gay men trying as much as they can to remember to be inclusive in order for us to support each other in the local, national, and certainly global, the World Cup in Qatar going on right now, and the atrocities of anti-gay punishments in Qatar, I think, is a world scandal. That's another whole topic. But, these countries where there is systematic oppression up to and including capital punishment for gay men, that's really a problem. That's really a problem in a civilized society on the planet Earth in 2022, which it is now. We have to fight that. That's a stress on us. That's a minority stress, to be a part of a community that literally is murdered for being who we are in certain corners of the world. That's a stress in society and in governments. So attending gay-themed events, anything, Pride, a bar, a club, a gay softball league, whatever, these are all good opportunities to advocate and to create a sense of support of each other that helps us to fight back against the minority stress. And that's an important thing. People can say, oh, how profound. Flogging in kink play has a profound social meaning. Actually, yeah, it does. So, something for you to think about, something for you to play with. I'm getting a lot of nice emails from guys all over suggesting topics. So, we have lots of topics still to come in future episodes. And, of course, if you have a suggestion for a future topic, please feel free to call or text or email what yours is, or a question. Sometimes I'm going to answer questions on here. So those are always welcome. Also, we want to spread the word about all this. So if you have a friend, particularly a gay male friend or a couple, who might benefit from the podcast and they don't know about it, please help spread the word. And if you can leave a review and rating and all that stuff, that always helps for visibility as well, because we want to get the word out and get these guys the support around the world that I'd like to think they would value from the show. So, thanks, and I'll see you next time.